It's Cadillac Unscripted on 107.9 CDY, and it's another half hour of local chat. It's sponsored by Independent Bank. I am Rich Spicer. My co-host, Katie, is otherwise unavailable today, but that's okay because she did last week's show solo, so one turn deserves a good one for another. We are going to do our once quarterly segment with Munson Healthcare Cadillac Hospital. We really need to have, to tell you the truth, Dr. Jim Whelan, maybe once a quarter isn't enough to keep people up to date on what's going on with the Delta variant. And so Dr. Jim Whelan, Medical Director from Munson Healthcare Cadillac Hospital, is with us. Hello, Doctor. How are you?
I'm great, Rick. Thanks for having me back on Cadillac Unscripted.
Well, it is our pleasure, and you're always chock full of really, really good information that people need to know about. So why don't we start right at the beginning? Tell us where the system stands, the Munson system, with fighting off this pesky virus that just won't seem to go away.
Yeah, so things have been... I'm just going to call them difficult and prolonged with this Delta variant. So we currently in the Cadillac Hospital have 9 COVID-positive patients. Across the Munson system, we have 74 inpatients. At our very worst, we were at 100. So that is kind of a little better, but this surge has lasted a long time. We've been in the mid-60s to 70s in the Munson healthcare system now for 6 to 8 weeks. It's just, instead of a sharp peak and a rapid fall, we've had a really prolonged plateau of high volume COVID cases. And our testing positivity rate has been 15 to 20% for the last month. And that has been higher than the state numbers. And as you see in the news, our state numbers are amongst the worst in the country. So we have had just a very, very tough, prolonged last month or two.
If we were to rewind, Dr. Whelan, about 6 months, let's go back to maybe April or May of 2021. So a little bit more than a calendar year after COVID first became something that we had to battle as a society. So going back 5 or 6 months, maybe 7 months or so, did you still expect, if we were to rewind, would you expect us to be at this point, or would you think we would have had a better handle on it by now?
I'm embarrassed to say, Rick, that you probably could go back to a radio show where I predicted a return to normal time that has proven to be wrong. So I wouldn't have expected us to have this prolonged, difficult surge. I think back then, maybe 6 months ago, Delta was just starting to get a foothold, and we knew it was going to impact us, but we had hoped it would just be like one of the other surges. But it has definitely proven to be more difficult just because of how quickly people catch it. So by the time they know they're sick, they've already shared it with others, where we had a little more cushion last time.
So what do you attribute that to? So
the number one thing is the fact that Delta is just more contagious. So the old virus, we kind of compared it to the flu, where if one person in a room has the flu, they might give it to 2 people. And the old version of the coronavirus, they might have given it to 4 people. But Delta, it's worse. Maybe it's 8 people now. So then if those 8 people go out and they give it to 8 people, you can see how fast and efficiently it spreads in our communities. And then the fact that our level of immunity in our community was lower than in many, I think is why we've had such a prolonged plateau rather than a sharp peak and an end, meaning that we had more people who could get sick and spread it because of a combination of easier, earlier surges and lower vaccination rates.
And that leads me into what was going to be my next question anyway. What does our vaccination rate stand at right now, locally?
Countywide, we really, you see in the newspaper, District Health Department 10 on their website also publishes county by county for their counties, and they break it down by age group. And so if we take our oldest residents, we're doing really well. In the high 80% plus are vaccinated. The numbers in younger age groups are lower, but they are continuing to rise. I think that this current surge, some mandates, and frustration with how long this is taking, along with more confidence in the vaccines, we're seeing a steady increase. And I think we're in the low 60 percentages overall of those eligible, and that wouldn't really count the 5 to 11-year-olds who just became eligible. I haven't seen the latest statistic if we include them, because suddenly we'd have another group not vaccinated, so it would lower our percent.
Sure. So this is a really difficult question, because what has happened here over the past several months is people have dug further into their decision to either get vaccinated or to not get vaccinated. You're seeing it's like a ring with a couple of boxers who are up against their respective ends, and they don't want to come to the middle. So it seems to me like the people who are resisting the vaccine are using the fact that that new things are happening to claim that they were right all along. Is that the wrong way of thinking?
Yes and no. So it would be completely hypocritical for me to say that we haven't been wrong in many of our predictions in the mainstream, healthcare industry during this pandemic. We've told people a lot of things that in turn, or in hindsight, were not as accurate as they should be, or just plain wrong. And so that it's understandable that would not build confidence in the vaccine for many people. On the other side of that, most people who are resistant to the vaccine are still watching the information and the data. And the longer we have been giving it, and the fewer negative reports of side effects and things like that are getting people more confident. We are sensing a lot of resistance just because now it's being mandated in some places. Mm-hmm. And it's natural for us, I think really even as Americans, to push back against things that we're forced to do. And so we understand that, but the longer we go, the more the data supports both the safety and the efficacy of vaccination. So we're going to keep asking.
The healthcare community overall is on board with the fact that this is safe, it's effective, and there is no worry. And it seems to me like the people who are worried mostly about this aren't worried about the immediate side effects, but they're worried about 5, 10, 15 years down the road. How do you counter-argue that?
I've actually had this discussion with a number of groups at the hospital who are asking very good questions about that and want that reassurance. And I would describe it this way. Certainly none of us can... We trust this technology because it's been around for 10 years. And so we do feel confident that we're not going to see those kind of surprising, very long-term strange reactions people worry about. What we also know is that things like long COVID is very real. And so you're still trading off the unknown of what are the long-term effects of getting a severe case of COVID versus the potential long-term effects of a vaccine whose technology we have been studying for more than 10 years. So I respect the fact that they can honestly claim we can't predict the future. However, if I thought they could avoid getting COVID, somehow in this pandemic, I would say, yeah, that maybe you make that gamble, but we're past that now. Everyone is either going to get immune through vaccines or by getting COVID.
So what are in the patients that you're seeing, the patients that you're hearing about, that you're reading about, what are the most severe long-term effects for those who got a very bad case of it?
So I would break it into two groups. So the people who were sick enough to be hospitalized many of them have permanent damage to their organs, heart, lungs, kidneys. For people who just got sick but not bad enough to be in the hospital, or maybe only briefly but not intubated or something like that, we are seeing a myriad of long-term effects, from headaches to chronic fatigue to neurologic problems like burning mouth, or kind of quite a spectrum that we continue to hear about of these nagging, and often so far we have many patients with more than a year of nagging symptoms after having had a moderate to severe case of COVID.
I know all of this information is new and studies are being done, and it might be hard to answer this question, but are you seeing in folks who have been fully vaccinated the same level of suffering with COVID, or have you noticed that it is less and people aren't getting quite as sick if they have been vaccinated?
So that evidence just in the United States is very powerful and is being updated essentially weekly, as every person admitted to the hospital, their vaccination status is recorded. And what the statistics are saying is that you are 5 to 6 times more likely to be hospitalized if you get COVID if you're unvaccinated, and you are 11 times more likely to die if you get COVID if you're unvaccinated than if you're vaccinated.
Well, that's pretty powerful evidence.
Yeah.
So at this point, we are now a year and 9 months almost into this. We did have you make a prediction here on a previous show. Knowing what you know now and knowing that there are still variables out there, where do you see us heading, Dr. Whelan?
I do believe, and I have a little bit of an optimism in here, so I'm gonna admit that.
Hey, we'll take all the optimism we can get.
I hear you. I do believe that we are getting closer to herd immunity, partially because we've had so many people sick this last surge, and because of more uptake of the vaccine and boosters, and the eligibility of younger kids who may not get that sick but are really good at spreading COVID. I think we're getting closer to herd immunity, and that this last long surge, when it starts to go down, we will enter what many people have been calling kind of the endemic phase. We all hoped a year and a half ago that this would be a flash in the pan, but I do think we'll continue to have sporadic cases as people's immunity wanes, whether it's natural immunity or vaccine immunity. And so there will be people who still periodically catch it, but it'll be much less, far fewer people at a time. And each person should get it less severely because they have either natural immunity or vaccination immunity, or both maybe. But so I do think once this big surge goes down, there's not a lot of really scary new variants out there that we're watching.
Okay. I will bring. I was going to bring up the flu, but let's put the flu season at the end.
Okay.
What about the new approval that has just been given for the vaccination for 5 to 11-year-olds. I've noticed a lot of resistance from parents and from people online about this. But then again, those who are resisting are the loudest of the group. Tell us exactly what you would say to comfort a parent who is struggling with whether or not to vaccinate their 5-year-old, 6, 7, 8, 9, 10, 11-year-old.
So there's 3 major points that I believe would convince me to vaccinate my child if they're in this age group. One is, as I've said multiple times, about the safety. We are convinced of the safety of this vaccine, and like I mentioned before, this technology has been around a long time, so we're not worried about long-term side effects, and I would put it in the same bin as all of the vaccines we recommend for children, that this is an important part of building their immunity. The second is that many parents think of it as like chicken pox in the olden days, where you would catch chicken pox, younger kids didn't get really sick, and then they'd be immune forever. But we haven't seen that kind of long-term immunity, and more studies are showing that natural immunity, while real, is more variable and does eventually start to go down. And so we wouldn't want to have kids have to get this annually. So the vaccine gives them better hope of not getting this recurrently. And then lastly is the same argument you can use, even the chickenpox example, but the chickenpox isn't benign. When we're older, we can get shingles. And who knows, again, we don't know what the long-term impact of a severe case of COVID would be on a child for the rest of their lives.
Mm-hmm. So your recommendation, obviously, is have that child vaccinated.
Yes, and I'll say, and I've said, I think each of our calls, sit down with your child's primary care provider, pediatrician or family doctor, and have the conversation.
Mm-hmm.
You would, if your child had a broken bone or your child had some other scary medical condition, you would trust that person to give you good advice. And I think when it comes to vaccines, you can trust those people to give you good advice for your specific child and circumstances, and you should ask them and then trust their recommendation.
Gotcha. Okay. So as we wrap up here, why don't we talk about how things are looking for flu season? Obviously, for those of us who believe in the science and believe in the vaccinations, we've all been kind of been pincushions the last about year and a half. Lots and lots of vaccinations, which for those of us who believe in the science, it's perfectly fine. We'd rather be cautious about it. But how about flu season this year? How is it looking? Is there a concern that this is going to be a greater than normal flu season, maybe a less than normal flu season? Where do we stand with that?
I won't try and predict how severe, because on the hospital side, our fear of what it's going to be like probably is greater than anything else. Because if we have a bad flu season and COVID is still anywhere near the levels we're at now, we're going to lose a lot more patients, our frailest patients. So we fear that. We know that the flu season has already started. We've had positives in every Munson hospital, so there are flu cases already out there. And so it's not going to be like last year where we had almost none. We will have a flu season, and how severe is very difficult to predict, because we don't really have data from other places on how this year's flu season was going to be.
What do you attribute last year's almost non-existent flu season to?
Big factors include social distancing and masking. We were much better at it last year during flu season, and lack of travel.
Okay,
So
that makes sense.
The flu thrives on family gatherings and travel. So I always call Thanksgiving the great germ exchange because people travel all over the country. They see their family members in one place and then get on an airplane and come back and bring whatever viruses they got exposed to back to their original home. And then it spreads from there. And that's really, honestly, how influenza spreads across our country. And typically our first bump of flu is right after Thanksgiving, and then again after the holidays, like Christmas.
So that was the flu season.
We'll know a lot more in a month. But
yeah,
I think we're gonna have a much more normal Thanksgiving than we did last year, and so it is reasonable to expect a more typical flu season.
So do you have the same concerns about COVID spreading during the holidays?
Yes and no. The way that COVID seems to have worked, those hot spots have already flared and calmed. And so barring a new strain, new variant, we should have a pretty small number of vulnerable people for it to spread. So we shouldn't have big flare-ups. We'll have some small ones, but we shouldn't have big flare-ups from COVID this holiday season. Just because, like I mentioned, we're getting closer to percentage of people with at least some degree of immunity.
So you're not discouraging people from traveling in 2021 as you would have in 2020?
Certainly not as much. From my perspective, we still have to protect our most vulnerable.
Right.
So if you have a family member who's currently on getting cancer treatment or a frail elderly family member, you should still try and protect them. Even if they're fully vaccinated, just some common sense precautions is a great idea.
What about folks who are taking immunosuppressants for prior conditions? Same type of precautions?
Yes, I think they would fall into that same vulnerable group. And then they have to make a personal decision how much they want to be exposed. And people then just have to be creative with their gatherings to try and protect them. But I know that it's safer than it was last year.
Describe some of those precautions that still should be taken. What are the social distancing requests that the health community is making at this point?
Still the same, similar to how we were. So as open a spaces as we can. As small a crowds as we can comfortably have, mask if we're not, or if we're able, so not eating, and lots of hand washing. Mm-hmm. Less of the typical close embraces and hugs that we're used to still.
Will there ever be a time again where hugging will be okay, Dr. Whelan?
Yes.
Okay, that's good to know, because I'm a hugger. I love hugs.
Yeah,
and that's comforting to know.
Probably we're all feeling the lack of them more than ever, and every month it seems that way. But I do think that when this becomes either quietly endemic or really fades away, there would be no reason not to go back to it. Some of us will still be scared to hug other people. This has scarred us in some ways, but I do think we will go back to that normal.
Well, it's good to end on a hopeful note. I think that's a great way to wrap it up. Is there anything else you wanted to include on Cadillac Unscripted today as we sit here in the first week of November before we wrap it up?
I just appreciate everyone and kind of how they've worked through things. I think that hopefully they're understanding at the hospital. We're still incredibly busy with lots of people in the hospital, both COVID and otherwise. We hate the visitor restrictions as much as anyone else, and we want to get back to normal as fast as we can. And so really we appreciate people bearing with us, and we hope they will until this really ends.
Dr. Jim Whelan is the medical director of Munson Healthcare Cadillac Hospital, and as always is full of great information as we continue to battle the COVID-19 Delta variant. And Doctor, we'll have you back in 2 or 3 months, and hopefully we'll have more positive news to give.
It'll be my honor, Rick. Thank you.
All right. Dr. Whelan, our guest today on Cadillac Unscripted, sponsored by Independent Bank. Join us next week, same time, same station for more local chat here on 107.9 CDY.